I am here at the SOHO conference in Houston, and I'll be talking about CAR T-cell therapy and CLL specifically tomorrow morning. And it's sort of becoming more and more interesting in CLL, which is a chronic lymphoma, essentially a B-cell lymphoma. It's considered to be a chronic sort of incurable condition with a lot of good therapy options out there nowadays with small molecule inhibitors, ibrutinib and venetoclax and other agents that are being tested in this disease. But we know that people who progress after being on ibrutinib and other novel agents have a much poorer prognosis and limited treatment options, unfortunately. And so there's sort of a need for better and better therapies in that situation. And that's sort of where CAR T-cells are now trying to make their mark. So CAR T-cell therapy, we take patients' own healthy T lymphocyte cells and we modify them in the lab to basically, instead of fighting infection, now these cells are trained to fight the B-cell lymphoma cells primarily in the body. There's a company called Juno Therapeutics which is commercializing a product that came out of the Seattle lab. So Seattle lab has already shown that their JCAR14 product has an excellent safety profile, but also really good results in CLL patients. And when they added ibrutinib to this manufacturing platform, giving it to patients around the time of collecting their T cells, but then also continuing ibrutinib for a few months afterwards, after they got their T cells back, they showed that the results were even better and potentially the cytokine release syndrome toxicity was lower and patients tolerated the whole process better. And so the Juno trial that I've sort of been leading accrual on at City of Hope, we've accrued up to 23 patients thus far across a couple of different dose levels. And this is just the Juno CAR T cells by themselves, but there's another cohort that's accruing that is combining these Juno CAR T cells with ibrutinib as well. So that data is still pending. But in the monotherapy arm, we've had some really excellent responses, up to 80% overall response rates, with half of them being complete remissions as early as 30 days after CAR T cells. And MRD, which is becoming a very important feature in CLL follow-up, was actually negative in the bone marrow and peripheral blood of these patients, up to 65% at day 30 or so. So very early responses, and what we've seen is people who become MRD negative early, they actually maintain the MRD negativity for a long time. We've had patients now over a year and a half almost, that we've been following, and they've maintained their response. So by and large, very good responses. There have been a few relapses, progression events, Richter's transformation events, and that obviously is still baffling to us. That's sort of the difficult part of CLL, when people have Richter's transformation to a more aggressive lymphoma. And then safety-wise, the Juno CAR T cells have been shown to be very safe with very, very little grade 3 or higher cytokine release syndrome. And very little grade 3 or higher neurotoxicity events, all of which is reversible and manageable. And then just to round it all off, so this is the JCAR14 and the JCAR17 product. The UPenn group in Pennsylvania was the first people to actually show CAR T cells work in CLL. And they recently talked about 2 of their patients all the way back from 2010 till now, 8 or 9 years later, who are still in a complete remission with CAR T cells still measurable in their blood, and they had failed like 8 or 9 lines of therapy. So very, very heavily treated patients who've maintained their response after CAR T cells. So that's what the beauty or the goal of CAR T cells is, to try to get to that holy grail of a complete response and a cure potentially in these CLL patients. And so some centers are also looking for other targets other than CD19, which all of these CAR T cells that I've named target on B cells. Other targets like ROR1, which is more just in lymphoma cells and not in healthy cells. So that could be one other potential target. There are other targets like CD22 and other things that are being investigated. So my talk is based mostly on the CD19 CAR T cells in CLL. And we know we've already had success in aggressive lymphoma, so now we're hoping we have the same success or even better success in this chronic disease.